So if I'm someone that's sitting at home and I think I've got the flu, it's not serious. I'm just achy, mild temperature, maybe sore throat, cough, runny nose. Right off the bat, right from the beginning, like, what's the best way to self-treat at home?
Yeah. So if you're an individual that doesn't routinely see doctors, hopefully because you're an individual that really doesn't have any medical issues, number one, you're more than likely going to do okay. And number two, you're more than likely going to do okay with self-remedies. And a lot of those remedies are rest, plenty of fluids, and then grab a friend rather than yourself going into a CVS or a Walgreens or whatnot to pick up any of a variety of a combination of Tylenol as a fever reducer, Tylenol also for pain reliever, and then a variety of decongestants, which can help clear up secretions. Sometimes these things at Robitussin DM, which kind of help loosen secretions so people can breathe a little bit better. The reason why Tylenol kind of pops up a little bit more with flu is that in the pediatric childhood population, it was determined that there's a condition called Reye syndrome in which aspirin should not be used with flu. That's not as common nowadays because for the most part, if you have a choice between aspirin versus Tylenol, also known as acetaminophen, when you have a flu-like illness, it's generally preferable to use that if you're a child. For adults, it doesn't really matter too much. Now, for individuals who are sicker, the best way to determine if you should call your provider is the easiest way is that if you're somebody who sees a doctor with a certain frequency that you need to see a doctor because you've got diabetes, high blood pressure, heart disease, chronic lung disease, HIV, AIDS, cancer, chemotherapy, any variety of things like that, even pregnancy, even obesity, variety of other what are called comorbidities, then the flu may be okay in you, but the flu may ultimately lead to secondary complications, or you may have a rough ride of it. The sooner an individual like that reaches out to their provider, particularly within 48 hours, in addition to the home remedies, they may be a pretty good candidate to the antiviral medications. But that needs to be offered earlier because it doesn't work as well after 2 days.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.